Just 4 days and a fair few critical headlines after launching the Conservatives' election manifesto, Theresa May has announced there will now be an absolute limit on how much people have to pay for their social care. The Prime Minister said the amount of the cap has not yet been decided and it will be subject to a consultation. She denied, however, that today's announcement amounted to a U-turn.
Nothing has changed. Nothing has changed. We are offering a long-term solution for the sustainability of social care for the future. We are ensuring that elder people, will not have to worry. They will be able to ensure that their care, whether it's in the home or for them to go into a home, is being paid for, and they won't have to worry about those bills month after month after month. And they will have the confidence of knowing that they can pass £100,000 of savings on to their children. Nothing has changed.
Well, the Prime Minister's denials of a U-turn came despite this response given by the Health Secretary Jeremy Hunt in a radio interview last Thursday when he was asked about a cap.
Not only are we dropping it, but we are dropping it ahead of a general election, and we're being completely explicit in our manifesto that we're dropping it. And we're dropping it because we've looked again at this proposal and we don't think it's fair.
Well, Sir Steve Webb is Director of Policy at the Royal London, the country's largest mutual insurer, and he was a Liberal Democrat pensions minister in the coalition government. He joins us now from Leeds via Skype. So, Steve, very good evening to you. First of all, are you clear this is a U-turn?
I think it is, as you just broadcast. Jeremy Hunt was saying that they decided a cap wasn't fair, but what's become apparent is that if you have a relatively valuable house, you could end up paying hundreds of thousands of pounds before you're down to the 100,000 limit, at which point state help was going to cut in. So I think they've realised that was toxic, and they've had to reintroduce the idea of a cap, as well as their other proposal.
Now, the cap, of course, was first proposed by Sir Andrew Dilnot when he did an investigation on this for the coalition government. Why do you think Mrs May ruled it out?
It's rather strange, really, because Sir Andrew Dilnot's not a party politician. He's a very clever chap. He consulted lots of people over a period of years. There was lots of debate. And what's really worrying is when something like that carefully thought through and legislated plan, gets replaced by something that I think was written pretty quickly and has already started to unravel. So actually, long-term social care needs long-term solutions. And the worry is if these things are rewritten very quickly, people just won't know where they stand.
Now, one of the things that Sir Andrew Dilnot recommended was that in addition to a cap, you'd have a market developing with insurers stepping in to cover unexpected costs. Is this a market you think insurers are keen to tap?
In theory, it should be, because we've got a rapidly ageing population, we've got huge amounts of housing wealth amongst older people, and the risk of catastrophic care costs. Put that together, that ought to make for an insurance market. The big missing link has been insurers would be covering what the state doesn't. And because the state has been so uncertain about what it's going to cover, insurers almost can't design a product to fill those gaps because they don't know what the gaps are.
So I guess it depends on where the cap is set. That's going to be pretty crucial.
Well, it is. I mean, if this is a sort of holding position through the election and then the cap ends up really very, very high, then most people could still pay a huge amount of money in care costs. I suspect if this all goes ahead, the cap will be high because otherwise it costs a lot of money to have a cap. It costs money to have the 100,000 threshold, and this measure will actually end up costing money rather than saving it.
So how much do you think this backtrack is actually going to cost taxpayers? I mean, I've seen figures of £2 billion or more being bandied around. Is that the sort of number you arrive at?
Given the numbers of older people, the ageing of the population, over time we could be talking serious, certainly hundreds of millions or more. The crucial question, of course, is where might the cap be? And the dilemma is we're going to have angels on a pinhead here. It's not going to be the Dilnot cap, which was just your social care costs. So you weren't capped at all on your board and lodging costs, which are a big part of the bill. Maybe this will be a total care cost cap. But, you know, how people are supposed to plan at the moment, I really don't know.
I mean, isn't there a case for just saying we should socialise all of these costs anyway? I mean, the sums being bandied around are still a drop in the ocean compared with, say, the entire budget for the National Health Service.
Well, certainly if someone has catastrophic health costs, needs heart bypass surgery or something incredibly expensive, then the NHS is there for all of us. We pool that risk. That's not the case with social care. Andrew Dilnot's argument is this is the last unpooled risk. And whether it's private insurance or social insurance, this really is an insurance issue. We're not going to all save enough to, just on the off chance we spend hundreds of thousands in care. We should find some way of pooling this risk.
And briefly, Steve, I mean, a lot of people will say you should never do a U-turn if you're a politician. But has Theresa May done the right thing in backtracking, do you feel?
I think the pressure was just becoming overwhelming. The polls were moving dramatically. And I think because the Conservatives have so long been the party of home ownership and of inheritance, and this policy seemed to fly in the face of both of those, I think the pressure meant something had to give.